Go ahead.
Yes, so we're recording.
Okay.
And go ahead.
Awesome. Good morning, everyone, and welcome to the second of the SAYAS webinars that we've been having. And I'm joined by a panel of esteemed colleagues who are coming from different constituencies and offices and have a wealth of experience in the different areas that they are working in to come and address a topic which I think is very, very pertinent in view of what is currently going on. I love the topic because it's framed in a very futuristic, hopeful way that there is a post-COVID world, and that's the hope that we carry with us each and every day. So we're going to engage for the next hour on what science will look like after COVID-19 and the impact that COVID-19 has on knowledge production and research in Africa. And we are joined also by a growing community of participants who are watching us streaming live. And some people will also watch this after this broadcast. We also welcome you to our engagement. A few house rules. What we will do is, for those participants who are with us on this platform, you will notice that there's a chat box on the side. So use that chat box for any engagement that you would like with any of the speakers. Please, if it's a particular speaker you want to engage, direct that question to say at Prof. Johann Morton, and then we can also engage to know where the question is actually directed towards. Without wasting any more time, and I'm looking forward to merely facilitating this and also learning from the rich panelists that we have, I will introduce the first speaker, who is, just get my notes here, who is Dr. Richard L.K. Glover, who's a program specialist for the International Science Council, the ISC, and the regional office in Africa. Welcome, Richard, if I say. We'll give you 10 to 15 minutes to give us your engagement on the topic, and thereafter we will go to the next speaker and open up for questions and comments a little bit later on. Richard, the floor is yours.
Thank you very much, Willie, and good morning to my colleagues and all listeners, those who are joining the webinar. As you were rightly told, I work with the International Science Council. My background is in microbiology. So COVID is an area where I think I'm a bit concerned with. So to go straight to the point, I have been following what is happening all over, and I've been listening to what many authorities are saying about COVID. And here I just want to share a few quotable COVID quotes that I picked. The first one says that African governments should shift their attention to strengthening health systems so that they are better placed to respond to the pandemic. And then the second one says, after COVID-19, nothing will be the same. There was a third one that I picked that said there will be no return to old normal after COVID-19 pandemic. This came from the WHO Director General. And then from my own CEO and another colleague in the disaster risk area, they said from COVID-19 crisis comes opportunity to rethink risk. These are quotes that are, I would say, are food for thought. And then that launches me into my next part, where I will say that my opinion about this whole idea is that after COVID-19, science will become more innovative, more targeted, more multidisciplinary and collaborative, and then it will be less ethically restricted. To explain this further, I just want to agree with what these authorities have been talking about. I picked something from the conversation, which is in South Africa here, but it's funded by the NRF and other agencies. And a lot of authorities have written in this, and one thing that they said, which I totally agree with, is that we have to rethink how research is funded after COVID. We realize that in this period, we've had to adopt very rapid responses to make sure that the disease is contained. And if it's possible to do it in this period, it means that after COVID, we can still do that. For instance, if we apply for research grants, for instance, it takes 7 to 9 months in the normal situation. But in this COVID period, within 48 hours to just a few weeks, funding is already available for work to be done, which means that after COVID, it should be possible for science to move very fast with the rapid response to funding. Then, secondly, we think that after COVID, we have to reimagine the publishing models that we use. That's sending out data on what research has been conducted. Of course, we have what we call the preprint manuscripts. That's those that have not been peer reviewed. They are being accepted now because information needs to be sent out quickly so that policy decisions can be taken. If it's possible in COVID-19 period, it should be possible after COVID-19, because at the end of the day, what we are looking for is information that is available, accessible, which is very fast and can be used. So why do we have to waste time to ask peer reviewers to review, and they will take ages to do it because they are not properly paid, and then by the time the information comes, it's outdated and it cannot be useful. So it should be possible that after COVID, science should look at using preprint manuscripts instead of depending on peer-reviewed data. Now, science becoming more targeted. Yes, again, when you want to do basic research, foundation research, that is what we must go for. And if we want applied research, that is what we must go for. So it will not just be like doing anything because we are doing science. So again, learning from what is happening in this period, as soon as COVID started, then people started working on the genome of the virus and trying to sequence it. And then quickly they provided information that is available for the very, very many candidate vaccines that are being produced, which means that it should be possible that after COVID too, we can do that. So we don't waste so much time doing work that would not go directly to the information that we need, but we should target science. Now, again, I think that science will become more multidisciplinary and collaborative. I'm saying this because some few weeks back, we saw in the news that about 239 scientists from various backgrounds and coming from 32 countries had to come together, putting their knowledge and expertise together to convince, not fully anyway, the WHO that notion that the infection is is by droplets is not totally true. That it could be that the transmission is also airborne. It means that if a lot of experts come together, whether in the natural sciences, engineering, the social sciences, and they come together and put their information together, it will make a greater and faster impact than when one person is kept or keeps himself in his lab and tries to come out with all the information. That means that collaboration is very important, because once so many people come together, they pool their resources and they bring out the information. Then they can get the policymakers to engage, and then they can know where to find money, for instance, to make sure that the work that is needed to be done is done very fast. The last that I want to put across is that science will become less ethically restricted after COVID. Again, we have seen during this pandemic that normally vaccine development takes a very long time. I mean, you have to go through so many processes. First, you do animal studies. After your first identification, you do your animal studies before the law has to come to allow you to test it on human beings and so on and so forth. But realizing in this crisis that people are dying and there was a need for application of medications or, I mean, developing vaccines, things are being fast-tracked so much that yesterday I was on that webinar from the NESAC, and the guy from Morocco, the Hassan Academy, was talking about so many candidate vaccines that are already being tested, and some places they are being used. We heard of Madagascar saying, no, we've discovered something that can be used to cure COVID, and it was allowed. Ethical considerations were relaxed. The medication that was talked about, the hydrochloroquine that people talked about before the WHO first came in to say, yes, you can use it, and now they say, no, it's not healthy. Because of the relaxation of the ethical considerations, they use those at least to save some lives. So I think that if it has happened in the COVID period, why not after COVID? We should be able to shift and move and do science in a way that will benefit humankind. Because at the end of the day, if we stick to rules, formalities, and the rest, and we delay everything, by the time you have your results and you want to apply it, the people that you want to apply it on are all dead and gone. Thank you. This is what I will submit for now, and if there are any more issues, I would come in to explain.
Thanks a lot, Richard. And it's quite interesting how you bring in the dimension of collaborative efforts in trying to address the challenge before us. Now, just quickly from my side, and maybe you can give little snippets from East, North, and the Southern African region where we are. What have been some of the most salient things you've picked up in the responses, particularly from the knowledge production side or the education side in response to COVID? And here in South Africa, we can talk a lot about efforts that are happening in accessing or creation of PPEs and, you know, any form of equipment being used. But from the North, South, and West Africa, any little snippets you can share with us?
Yeah, okay. I think generally we were not ready for these PPEs and the rest because Africa, you know, we are always a bit behind. But luckily, most of the areas got donations from China, Germany, and all those, even though they were also highly affected, but we got those donations. And then quickly, people started producing this. Local industries started producing PPEs, for instance. One other thing that happened was that the various governments from all areas fell on the scientists for advice. So they quickly went into the lab, they came out with information about how, I mean, the state of the virus, how it affects and infects, and then they formed task forces. In South Africa, we call it the National Command Council. I mean, you have the Ministerial Advisory Body, which is spearheaded by the MRC, and then you have the center, the CSR, which churns out information every time, which advises the government on what policy initiatives to take. So yes, it was a panic situation, but all over Africa, from all corners, I think people quickly rose to the task and they mobilized the scientific community as well as the individuals who matter to make sure that the situation can be contained, albeit slowly as it is in Africa.
Thanks a lot, Richard. And we look forward to engaging you a little bit later on through the comments from the participant. Moving on with our program, let me introduce our next speaker, who is really well known to all of us, Prof. Johann Morton. I was joking with him that 2007, I got a copy of a purple book, How to Succeed in Your Master's and Doctoral Studies. And a couple of years later, I'm still recommending that book because of the impact it has in assisting students in research competencies. So Prof. Morton, welcome, and we look forward to your engagement and hearing from you.
Thank you, Willie. Thank you very much. I'll ask either Renata or Edith to share the one-pager that I have sent beforehand. Also, welcome to my colleagues and to all the participants in this session. I have decided to focus on 3 issues, and we'll just spend a bit of time on each of them. The first is the question, yeah, that's fine, thanks. The first thing is that I think we always need to be clear about what we mean by science. The first thing to say is that when I think about science, I think of the whole encyclopedia of science, all scientific disciplines, from the natural life, health sciences to the social sciences and even humanities. But there's another distinction which I think is very important. Science by its nature is a cognitive enterprise. It is about producing new knowledge, and it has been that through the ages. But at the same time, we must also understand that science is a social institution. So in trying to address the question, what will science look in a post-COVID world, the first question that I try to address is, which of these 2 meanings are we talking about? If you talk about science as a cognitive enterprise, it's an enterprise that's driven by the pursuit of the most truthful knowledge that we can produce, which I call in various publications the epistemic imperative. And where the predominant rule of the game is the rule of evidence. Good science is science where we produce findings that is based on robust methodologies and that produce conclusions and results that are underpinned by that evidence. And in fact, my first point that I want to make this morning is that from this perspective, science as a cognitive enterprise pursuing truthful knowledge has not changed materially over the last number of centuries, and it's unlikely to change in the future. So in a post-COVID world, the rule of evidence in science will still apply. We will still aim for robust knowledge to be produced. Otherwise, if that changes, then we have a very different thing, which we cannot call science. But of course, the second perspective, looking at science as a social institution, is something that has changed and continues to change all the time. From this perspective, we're looking at science and how it's organized and institutionalized, where we do science, how we organize ourselves in doing science. For instance, one of the things that Richard referred to is collaboration and new forms of collaboration. That's one of the social forms of science. Where we publish and how we communicate our findings. These are all parts of the social institutional dimensions in science. And they've changed. I don't think anyone will disagree with this. We know that in the digital age, the way that we communicate science, how we publish science, the role of libraries, the role of journals, the way that collaborations happen virtually, now conferences happening virtually. So, of course, science as a social institution will continue to change. So this is the first point that I would like to make today. One is that will science be different in a post-COVID world? No, if we refer to the cognitive core of the scientific enterprise, but almost certainly yes, if we refer to the social organization of knowledge production. And we can give more examples. Let me get to my second point. And this is something that a number of people have talked about, and it's the issue about the role of scientific advice and trust in science. We know from various studies in science communication over the last 20, 30 years, various organizations do studies about public attitudes and perceptions of science. And if you look at those results, which are very well known, in most countries, the general public puts a lot of trust in science, and they usually have. And in fact, when you ask the general public in most countries whether you trust scientists more than politicians, not surprisingly, yes. The media, religious leaders, community leaders, and so on, you generally find that the trust in science is either the highest ranked or the second highest ranked, depending on the country. Now, what's happened with the advent of the pandemic is that we have seen pretty much in every country, and I'm including countries like America and other countries where it's not always obvious, that the trust in science have been reaffirmed. And the narrative has been, we should have science-based, evidence-based, fact-based decision-making. Now, one has to be careful here, because the trust in science by the general public or by whichever publics we're talking about, whichever stakeholders, need to be always tempered and moderated, because in some of the statements that are made in the media, and when you look at media briefings even by government officials, it sometimes starts to verge on a very unhealthy statement of absolute faith. So this is the kind of old modernist utopian view of science that started in the 16th, 17th century, and was really part of the 19th century positivist movement, that science will actually solve all our problems. So we have to be careful that if you reaffirm the trust in science, that you don't also start to see science as the kind of new religion or ideology that will solve all our problems. So this reaffirmation of the trust in science is therefore both good and bad. It is good in the sense that it makes the juxtaposition, the difference between evidence-based or fact-based decision-making and decision-making that is informed by ideology or anecdotal evidence or politics, much clearer. And I think it's a generally good result that juxtaposition is made clearer. And one of the reasons why I believe that is that the voices of populists and pseudoscientists in many of these debates have been somewhat silenced. I don't think they've been silenced. We can see that they are clearly, and I know that some of the people on this webinar are aware of these developments. You still see pseudoscientists and populists advocating solutions that are not science-based. So this is generally good that there's a renewed affirmation of the trust in science. But there's also a very interesting downside, even paradoxical. And that is, at the other extreme, we've also seen what could be termed a new form of absolute view of the nature of the scientific enterprise. So I listened to prime ministers, government officials, the World Health Organization when they have these briefings, and people reaffirm, or at least again restate, that science is completely objective and typically produce certainty. And so in this attempt to distantiate science from pseudoscience and fake news, the pendulum often shifts to the other extreme, and science is now equated with absolute truth and objectivity. If we can just scroll down to the second part of the page. So the point that I want to make here is that most scientists don't really believe in absolute objectivity and absolute truth of their findings. Most philosophers of science will remind us that scientists are fallible. They make mistakes. Most scientists would agree that their scientific results are often provisional and often corrected by future studies. And of course, science has never been and will never be completely neutral. So other interests, whether it's political or ideological, get interwoven in strange ways in science. I can just remind you of the big debate that we've had in this country in the last 3 or 4 weeks, around the paper published by a UCT researcher, how politics and science got interwoven. So my second point, our penultimate point, is that it It is good on the one hand that the trust in science and the belief in science has been reaffirmed, but I get a little bit antsy and a little bit concerned where the alternative view that is propagated now by some people, which is not, I think, generally held by scientists, is that, science is therefore completely objective, it's true and produce certain knowledge, because clearly that's not the case. And we see that very clearly even in debates in South Africa, where there are disagreements between scientists within the same field about what the models mean and what the projections mean. My final and last point on scientific institutions. A number of interesting things that Richard spoke about speak to this. I think that there is a real danger inherent in many of the current responses to COVID, forms of short-termism. It is quite understandable that decision makers at various levels of the science system must address the immediate challenges of the pandemic. And of course, we all agree on this. And they must think creatively and innovatively how science can contribute. And generally, I think there's a consensus in the world that science has responded very appropriately. The notion that Richard referred to as rapid response comes to mind. And so that, I think, is to the that is a major positive development. Now, concomitant with dealing with the response, which is a public health response or a challenge, are the huge demands in every country being put on the fiscus, which has already resulted, unfortunately, in the diversion of public funds away from science and other scientific fields. So we've seen that again in our country in the last week, the cut to the science budget, to the NRF budget. Of course, money is diverted to dealing with the pandemic. But the point that I want to make here is that, and I see that there's some conversation on certain platforms, we have to just occasionally remind ourselves that scientific institutions, universities, science councils, national research facilities, national institutes, centers of excellence are built up over many decades. Strong scientific institutions are built through incremental accumulation of scholarship and expertise over time. And it takes literally decades and centuries to build them up, but you can kill them very quickly. And unfortunately, in South Africa, there are examples where some of our key institutes, like the South African Institute for Medical Research, some of the centers of the Agricultural Research Councils, our museums, have actually been neglected over time and ultimately had to close down while they've been built up over a long time. So you can, if you don't invest in the long-term support and funding for key institutions, then you run the risk that when you really need them, you don't have them. And the most interesting case for me is SASEMA. SASEMA is the South African Center for Epidemiological Modeling and Analysis, which is based at Stellenbosch University. And you may recall the South African participants that when the government asked for the first modeling of the virus, they turned to SASEMA in February and later to other consortia from WITS and UCT and elsewhere and the Medical Research Council. But what people don't realize is that SASEMA was on the brink of losing its funding as a national center of excellence. In fact, they were in the process last year after having been funded for 10, 15 years from national funding because it was not seen as a strategic center. And in a huge irony, who does the government turn to ask for the first modeling of the epidemic, the pandemic? It was SASEMA. And so they since then have got a new lease of life. So this is really important, and I think it does link to something that Richard said, is that the funding of science in the post-COVID world will have to be a real balancing act between funding areas where you can generate a strategic and a rapid response, but at the same time, you cannot, because we don't know what the next crisis will be, whether it be around climate change or another pandemic or a drought or whatever the case might be. And we have to make sure that, especially in Africa, where we have a dearth of strong research institutions, that we do not only think on in terms of the short term. Thank you, Willie. That is my contribution for the for the session.
Thank you, Prof. Thank you, Prof. And I take a few pointers from your presentation there around the importance of also the human side of science. I mean, a huge expectation and a burden has been placed upon finding solutions, and I think you bring out some very clear nuggets around objectivity, and also trying to embrace that, yes, science will also fail here and there, but we must also be cognizant of the bigger picture. And I like that, particularly in view of the current challenge that we have. We'll come back to you, Prof, later on for some engagement. We have our next speaker from the Nelson Mandela University, where she holds the portfolio of Deputy Vice Chancellor, Research, Innovation and Internationalization, Prof. Tandim Mugwebi. We welcome you, and looking forward to your presentation.
Sorry, I was speaking to myself. Thank you very much, Willie, and thank you, colleagues, for those who have already spoken, and thank you to everyone who has joined, and greetings to everyone. My contribution is trying to look at this in the form of the role of science, or the role of how we strengthen the policy nexus, the science policy nexus. I'm trying to move to the next slide, but it doesn't look like it's working. Just hold on, please. There you go. Okay. Okay, and it's my contribution is on impact on science policy nexus, the impact of the pandemic, of course. And I want to touch on a few things on the geopolitical tensions and the lessons from the past, on the role of scientists in diffusing these scientists, and I will speak briefly about scientific evidence and the role of the partners. Prof. Johann Morton has already spoken a little bit about this when talking about scientific advice, and also the notion of science in service of society. And I will make a few examples from our university, Nelson Mandela University. What we have seen from the pandemic is that it's been characterized by geopolitical tensions. In fact, what it has done, it has amplified and shown a bright light or bright spot on the pre-existing tensions between the United States and China, particularly that were existing in the past, including those in science and technology. What we do not know is where this will lead us. There are two options. It could lead to greater tensions, which could be destructive to both parties, or it could lead to stable and constructive relationships that can lead to more opportunities and, of course, benefit to the world. There are important lessons to be learned from the past. But before I go to those, there are also opportunities in all of this. There's opportunities for science, the collaborative efforts that scientists play, that they displayed during the pandemic. In fact, the science diplomacy and trans-regional cooperation is becoming more and more important. Important lessons from the past, from the Cold War, in fact, have shown that science came to the fore. In fact, science diplomacy of that time it may teach us how to respond to the situation in the form of the geopolitical tensions. Between 1945 and 1991, science diplomacy played an important role in preventing relationships that could have gone very, very bad and destructive between the United States and the Soviet Union at that time. It led to a establishment of critical institutions and initiatives that were science-based. I can speak about the 1957-1958 International Geophysical Year that led to the signing of the Antarctic Treaty in 1959. That was during those political tensions. It led to peaceful transitioning such that we are now able to conduct research in the Antarctica. And therefore, science had a purpose in terms of conventions, in terms of treaties, in terms of policy changes during that time. What I'm trying to say here is that during the pandemic, you may find that there are institutions that become catalytic for promoting peace and stability. I'm talking here our own institution, like the academies, the funding organizations, and the national bodies, the universities themselves, the research institutions. These are catalysts that could help us bridge the gaps and allow the tensions to be less destructive and come up with new policies, new engagements and agreements between countries, sometimes without the support of the governments that are involved. So it's important to learn that science focused on dealing with fundamental questions and global processes for maintaining connections. These connections are important for building the future and for strengthening the societies. My second point on this is that China has invested a lot in its capacities in science, in terms of human resource capacity, in terms of research outputs, in terms of impact. And also it's expanding its influence over international policies. I'm talking here about an example of the Belt and Road Initiative. China is aligning the Belt and Road Initiative to the SDGs, for example, aligning itself, therefore providing greater influence into international policies. And this places China in a positive light in terms of diffusing tensions and what scientists can learn from these initiatives and what we can benefit from the initiatives. The other point is that the pandemic has shown the deep inequalities that existed before. For example, hunger, poverty, not only far away, but also locally. We've seen the impact of the pandemic in our communities. It has increased, or it has emphasized or amplified the hunger situation in the world, but also in our communities. In the context of universities, this is challenging the role of our international partnerships and our international offices and our international collaborations with our partners in servicing societies where we live. And also it's challenging the research organizations and research institutions around the world in tackling what the global challenges and what we could term as what is more important and what is more priority in terms of dealing with the global challenges. The other point I want to make is about the role of scientists and the role of the public in strengthening these policies. The policy coming from the knowledge that is generated at the research organization or at the research institutions. That science must maintain its integrity in order to be of benefit to society. Should the integrity of science be shaken, then the trust in science will decline. Therefore, I'm not actually of the view that peer review should be demolished. I'm of the view that peer review should be strengthened and should be jealously guarded, because it improves, or it at least upholds the integrity of science. The second point is that the full range of scientific disciplines should be included. We have seen with the pandemic, most of the work being focused on research, on vaccines, on development of vaccines, development of treatments. But there are also underlying health issues that require social sciences and humanities that are also beginning to come to the fore. For example, mental health issues, the hunger issues, the cultural issues. And these are all affecting communities where we would like to improve in terms of development and human development. The other thing that I don't think will change is that scientists must also use established communication channels for providing policy advice more effectively. This is becoming more and more urgent as we move towards, as we make impact, and the challenges are becoming bigger and bigger. But also scientists must listen and respond to what the public is saying in terms of criticism. And what is expected of the public? When I say public, I'm referring to all forms of public. I'm referring to media, interest groups, and the public in general. The public plays an important role in influencing policy and therefore must be included in the decision-making process. What I mean by this is that universities should not come to the communities as knowing it all, but what should happen is strengthen that co-creation of knowledge with communities. Industry is an investor in knowledge generation and science, and therefore industry should also be involved and not be left behind. Similarly, interest groups have a voice, and they are the guardians of the common good, what is usually called common good. And also the advice from any source to policymaking must be acknowledged as far as possible. So if I were to summarize from what I've said, is that there's pressure that's growing about bodies such as academies, our research institutions, our universities across the world to remain catalytic in providing knowledge and in providing solutions. The universities and their international dimension should strengthen in order to allow collaboration between countries and to diffuse the political tensions that are happening between countries. And I will stop there, Willie, and I'm happy to take any questions.
Thanks a lot for that presentation. I was very, very much intrigued by your first slides, which was talking about the geopolitical issues. And I often feel that we've been caught up in a war between two powerful nations where someone in Luksikisiki is just a victim of all of these things that are happening. That was quite an interesting area. Just a follow on maybe, would you comment on indigenous knowledge? Where can we position indigenous knowledge in this post-COVID world that we're talking about? Here in the Eastern Cape, there's a lot of talk around the role of herbs, medicinal herbs, in trying to also assist the problem that we currently have. Are we going to see a more heightened approach and a focus towards IKS within the realm of science, and even giving more impetus to the important role that IKS plays?
Definitely. I think when I mention co-creation of knowledge with communities, this involves bringing to the table the knowledge, often called traditional knowledge of communities, that has been there for some time. And what I would propose is that when universities engage communities, they're not coming there as a superior, but they're coming there as sharing the knowledge and creating solutions from both ends. So this is where indigenous knowledge systems become important and should not be dismissed, because these communities have been using this knowledge for some time without the help of universities, actually. And it's now time that we come together and we develop solutions that can be amplified and can be scaled up to address the problems. So I do see a situation where indigenous knowledge systems become at the center of knowledge translation and knowledge creation.
Thank you, thank you. Let's go to our last speaker, not the least, Dr. Petiwema Tutu. If you want to fill up an auditorium at any university, just tell them that the National Research Foundation will be here, and the numbers are bound to grow up, because this is a very important office within our country, particularly assisting towards the funding of research and supporting students and staff. So with this important office, Dr. Matutu, welcome, and the floor is yours.
Thank you very much, Willie. I'm wondering, are we sharing a presentation on the screen, or can I just speak from it from my side without sharing it?
I'm sure, Edith, you can unmute there yourself and just respond to that one.
Sorry,
There we go.
I'm sorry, I can share it on the screen, so let me get it on properly, then I can do so. Give me a minute.
Yeah. So are you okay now? You've managed to share it?
Give me a minute, let me put it up. I think I had Richard's on, so yours was, okay. Coming up now.
Well, while you are doing so, let me start by thanking SAYAS in organizing this webinar, which is so critical at the stage of the pandemic's development, where we're trying to envisage a future in terms of knowledge production. Will you be moving it from your side?
Yeah, I'll do so.
Okay, no, that's fine. So we will end. Good morning, colleagues, to everybody who's attending the webinar. We'll start then on page 2 on the presentation and what it will entail. It will have 3 sections, and the first one will be the COVID-19 and its impact on society, because in order to address that impact on society, science will be, and research will be quite critical components of that. And some will happen post the COVID pandemic. And the next one are the science, technology, innovation systems in various countries and how they are responding in addressing COVID-19 pandemic. Finally, we look at the COVID pandemic's impact on the knowledge production. So we'll start with the first one, slide 3. So the first one, which is the pandemic and its impact on society. The pandemic has negatively impacted the most vulnerable in our society. In terms of the economic impact that it has had and the social impact that it has had. So government have been left scrambling in order to save lives and to save the livelihoods. It has been a very difficult balance to make, as you can see in various governments, including ours. And the sad part is that it has brought out this whole issue of what is working, what is not working in our society, the triple challenges of poverty, inequality, and the third one is what I forget now, what our government is calling the third one. They have been brought out by this and magnified by this pandemic. This is what the UN Secretary General had to say. Is saying that this pandemic has laid bare the risks that we've ignored for decades. Inadequate health systems, gap in social protection, structural inequalities, environmental degradation, the climate crisis. This is what he had to say in the Nelson Mandela lecture. It is exposing fallacies and falsehood everywhere. The lie that free markets can deliver health care for all. The fiction that unpaid care work is not work. The delusion that we live in a post-racist world. The myth that we are all in the same boat. So essentially, highlighting the impact of COVID-19 on society is saying that post-COVID-19, there will be a need for society to rethink some of its fallacies and the falsehoods that we've lived through all this time and believing that they are going to assist to advance human development. And it is through research, it is through knowledge production that one can look at alternatives which are likely to work, that will be able to address these structural problems that are being highlighted here by the SG of the United Nations. This is how the STI systems have responded in addressing the pandemic. There has been a heavy skew towards the clinical health science in terms of the knowledge which has been produced to inform decision making. And there's an urgent need to fund the social sciences research, including multi and transdisciplinary research, in order to address the COVID-19 pandemic. As we can see, we're having the psychosocial effects of COVID-19. People are really getting quite distressed, and no natural sciences or clinical sciences can address this, because they tend to address it at an individual level, yet the trauma is at a global level, at the continental level and at country level. So it becomes important that we look at the transdisciplinary research with the intention of including the social sciences research in whatever we are doing. And the research and innovation has been used in to develop the diagnostics, the treatment options, equipment in healthcare, facilities, vaccines, and to inform decision-making in combating the spread of the virus. So what I will do is just to look at some of the impact which I'm picking up in terms of the knowledge production. That will be my next slide. So this is the analysis which has been made by Dimensions database, where they are saying that even before we reached the halfway mark in 2020, already our outputs, research outputs, they were more than 100,000 than last year's full year's outputs. And they've seen that the US, China, the UK are the leading producers of the coronavirus outputs, based on analyzing using their app as well. And looking at some of the publication, the journals, they are outlining a decline in the number of the articles which have been submitted by women. And they are looking at the investigation of that. This is being ascribed to women being busy with childcare and housework, and it looks like we are then going back in terms of the advances that we have made in order to ensure equality by getting women to do the traditional things that they've had to do, which is your childcare, which is your housework. And also the process of producing knowledge has necessitated data sharing, collaboration, dissemination of research outputs outside the journal paywalls. As you can see that immediately the information on COVID was available. We've received that information, and the journals have been able to share that information worldwide. So also what has been highlighted is the need for science advice, for science communication. It has been elevated in the wake of the pandemic. A number of governments have put together these task teams, which would include scientists in terms of advice. And at the same time, most of the the media publications would make available anything to do with the pandemic, and the journalists have focused extensively on that. So what I'm going to do now is just to highlight a few examples of the NRF's involvement, whether it's through research or through innovation in combating the COVID-19 pandemic. So we have made this call on the COVID-19 Africa Rapid Grant Fund. And what we have noticed is that the networks are important here. We've had partners who are prepared to fund and who are prepared to enhance the already existing networks that they are funding in the continent. And those funders have been IDRC from Canada, which has been funding the 15 science granting councils which are in sub-Saharan Africa. We've got Quebec, which has been funding the Francophone countries. We've got CEDA, which has been funding the Arua universities, UK as well, interested in that. And we've got South Africa, which is interested in funding South Africans. So the NRF is running that call and is managing it. And looking at the fact that over a 2-year period, what was available here altogether, including the operations, was about 90 million rand. We've received 526 applications. These applications, they have 3 strands, which is research, research and science journalism, and which is policy advice. So this is fairly new. We have never done anything like this, having a way of integrating science engagement and into the research. So those are the three strands that we have in this call. So that is quite unique. And also the fact that we've partnered with other funders, and the networks have become quite a critical component of doing that, and it had to be done rapidly in order for us to be able to respond very quickly, and the partnerships had to be very, very visible. We've got we've been asked, our national facility, the South African Radio Astronomy Observatory, which has been quite crucial in the building of the meerkat. It has been asked by our Minister of not finance, industry, to oversee the process of building or manufacturing ventilators within the country. So because of that confidence and that capability that has been there, this has been possible, and we are looking now at 2 functioning ventilator prototypes, which have been co-developed and designed with the CSIR together with some of the engineers within the country, and at a fraction of the cost of what the normal ventilators normally cost. And at the same time, these are non-invasive ventilators, unlike the ones that we have in the healthcare system as we speak. So now what has happened is that some healthcare facilities have approached SARAO and SAWO engineers to say, can you please assist us with developing or at least designing the appropriate shields, the appropriate equipment for protecting our staff and so on. And the lovely thing is that when they are designed here at home, they are going to be very, very specific to the needs here. And at the same time, the manufacturing is going to happen here. So I do think that the whole issue of manufacturing, which we had I would say in most instances outsourced to China, is something that we are going to have to look into, and the capabilities which are within the country, so that we can respond adequately when there are challenges such as this one. And the usage of accurate data to inform decision making is another thing which the NRF has participated in. We've got one of the national facilities which has partnered with Wits University, and they've used AI to determine and predict the evolution of COVID hotspots in Gauteng. So they've been calculating all the hotspots, having interactive tools in order to model the epidemiology of this pandemic. So also SAYAS has been able to have this planning tool where it identified vulnerable communities, looking at a local level on the comorbidities, the access to sanitation and services, healthcare workers, demographics, and so on. Also, it's an interactive tool that you can use to assess the various areas within the country. And then we've already spoken about SASIMA, which is looking at the projections of the COVID-19 case numbers, or the infections, whatever rates that are required in terms of the modeling of the disease. So in terms of science engagement, we've got SASTA working to support the science journalists. So they are supporting about 26 interns as we speak, and the interns are focusing on their South African languages in order to provide reliable information to the people. And we have a number of funded researchers who are appearing on TV day in, day out, or in the media day in, day out. And we have a magazine that we're producing, which is called Science Matters. The main issue was solely focused on the COVID-19. So with those examples, I think one should be able to have some kind of a grasp on what the research and the innovation are capable of delivering in addressing the current problems. So as it has been outlined, Dr. Glover did outline this issue of the need to improve the cooperation, the collaboration, coordination of all the actors in the different national systems of innovations, the different countries, in order to respond to the pandemic and other societal challenges. And it is evident that funding is not going to be forthcoming after this, because of the economies would have collapsed, and at the same time, as you can see already, we are seeing those cuts. So we can't afford to be wasting on the work that we do. We have to make sure that we are coming up with more using less. Then the issue of the availability of the research that we produce, the data sharing. So advancing the open science through initiatives such as the African Open Science Platform that we are hosting as the NRF on behalf of the African continent is going to be very important in future. Because we do need to share the knowledge that we produce, and at the same time we do need to share the data that we pay so much to produce by servicing the infrastructure that we have that produces that data. So advancing our different systems capabilities to enable data sharing, to handle big data, in order to inform decision making is going to be quite big already. Sarawa was highlighting its capability of working with big data to do the predictions. You'll find out that the infrastructure is with the CSIR, and something else is somewhere else. We need to be much more organized and ensure that we get to the stage where we can put our heads together and respond appropriately. What is evident is that mission-oriented research is certainly going to be advanced in future through a number of enablers, such as your merit review instead of your peer review that we are used to, ensuring that the users of research are also part of the reviewing panels, ensuring that the people who research is going to be conducted with and on are part of the panels. Those people where there's a claim that they are going to be using the research are part of the panels, and advancing engaged research where all the players co-create, as Dr. Mkwebi has outlined, and the information and the knowledge that gets produced. We use proper science communication channels to communicate it, and we use proper policy advice, which has been properly planned in order to disseminate the information to the appropriate users. So also there will be a need to maximize research impact by encouraging researchers to plan for impact with clarity on the pathways that they will follow in order to maximize that impact. And this is not saying that fundamental research will have to be forgotten. It's just that it will, I think one of the people, I think it was Dr. Glover, was saying that it is not just going to be, you know, you do as you like or you do what you like. There's going to be a deliberate effort where one is looking at basic research as this part of the pot, and mission-oriented research at this part of the pot. We already have a 10-year vision as the NRF, and we would like to have an appropriate balance between the two. So we are saying that mission-oriented research will not be at the expense of fundamental research. However, we need to aim better and to plan better on these things. And the advancing of transformation and equality of the researcher workforce cannot be forgotten. As you can see that because of COVID-19, we may be losing ground already of the gains that we already made. So one cannot forget that after COVID-19, one has to assess the situation and when necessary, put the interventions to ensure that we have an inclusive workforce that can be able to resolve and address the challenges that society faces. Thank you very much.
Thank you, Dr. Matutu, for that presentation, and thank you, colleagues, for all your presentations that you have given us. And I can tell you from the chat box where a lot of people are enjoying the presentation because they speak to various issues that are technical and issues that are specific to the work of researchers and issues that are specific to the work of institutions. Now, this is the exciting part for me because we get to involve our panel, our participants rather, to the engagements that we have just seen. I will start with or engagements that we've just had. I will start with a question to Dr. Glover. And this question is around ethics. Will ethics be restricted or relaxed after COVID, or are we saying that the ethical review boards will become more agile in their processes because some boards were taking long to give feedback to researchers? So this is an interaction between the process of ethics and the work of ethical review boards. Just have a go at that one, Dr. Glover, and then we see other comments and questions coming through.
Yeah, thank you. I actually replied, but I can still say something to that. What I meant was that
Dr. Glover? Okay, I think let's move on. Maybe he'll rejoin us. Prof. Morton, what advice would you give to new researchers at various universities in Africa and abroad who just want to complete with their studies by any means in view of the challenges of ethical point of view and more?
Yes, I saw that. I'm trying to understand the question, Willie. So is the question at one hand seems to me that this is a question from a postgraduate student who says, well, you know, I'm enrolled for my master's or doctoral studies, and I want to make sure that I am properly qualified within an appropriate period of time. And it sounds to me that the person is concerned that COVID and its impact will affect the completion of his or her studies negatively.
Yes, yes.
If I understand that correctly, then I'll respond to that. Yeah, I think that, you know, there are many dimensions to this. One is that we've done, as some of the people know, we've done many studies in Africa. My colleague Nico Klute has done many studies in Africa. And you know that the quality of supervision, for instance, the capacity to supervise varies from institution to institution and country. Now that we are in a situation where master's and doctoral students may not be able, in many cases, to see and meet their supervisors face to face, it places a huge burden on digital platforms to provide support to students. So that's an issue. And of course, Thandi and Petit were correct. We now have this very unfortunate situation that if you are enrolled at the top research university, where there are good digital support, good electronic library resources, then you as a student are less affected by the pandemic. But if you are enrolled at the university where there is not good connectivity, you relied on being in a library, you know, to work, then you're affected more negatively. So there really is a disproportionate effect also on students who require support. I mean, so that I think that's the one point to make, is that it's going to be more challenging for students. Second point to make is that there are big differences between the fields. One of the commentators have made the point about qualitative research. So if you are in the field where you need to be in a laboratory or on an experimental farm because you work in agriculture, or you have to interview people through qualitative interviews, preferably face-to-face, and you can't do that for your PhD, then that's another problem. So the access to equipment and facilities, if there are, of course, ways to get around this. We can get around face-to-face interviews with Skype interviews, etc. So I think that my general response is that what are implied in your question is that there's a greater responsibility on all universities in the world and in Africa to ensure that the support that they give to their master's and PhD students are sufficient that they can complete it. It might be tougher under certain circumstances, and they might require additional funding, which might not always be available. On the other hand, you know, we all know, and we all say that to our students, we know that doing a PhD is inherently a lonely endeavor where you work for 3, 4, 5 years, and you have to be resilient, and you have to be consistent and disciplined to complete what is probably your first major, you know, research project. And now this happens under conditions of lockdown and COVID, which means that it's even more trying. And so I think my general point would be that it means that our institutions, our supervisors, our academic centers, our funding partners have to be more aware that it is more challenging to complete your studies under these conditions. Thank you.
Okay, thank you, Prof. I'll go to another question and we'll come back to Dr. Glover. This one is directed to Prof. Mugwebi. And I think those issues of geopolitics you were talking about maybe in a subtle way come out here. What is indigenous knowledge and who decides whether knowledge is indigenous or not? And linked to that question, obviously, is this issue of the subtle undermining of medicinal herbs, particularly locally grown and produced, and how they make it from probably the farm to the shop, and the challenges that brings, particularly some form of legitimacy around the contribution that such indigenous knowledge can have to this wider problem. I don't know if you want to have a go at that, Prof. I think you may need to unmute there.
Unmute here, let me unmute, yes. Yes, I think I've unmuted now. Okay, so indigenous knowledge has been referred to differently by different people, I guess, depending on the context. But from what is clear is that it's defined as the knowledge which is, it can be spatially or culturally context specific, and holistic and adaptive, and it takes into consideration the understanding of skills, philosophies that have been developed by local communities. And it's got long histories, and these communities have got long histories and experiences of interactions with their natural surroundings. And so it's within the communities, and that's where it resides. That's why it's so important, what I was stressing, the importance of partnership with communities without coming as superior. Because these local communities have been using these systems for a long time and have survived. And they range from use of agriculture, spiritual connections, cultural practices, and even medicinal purposes, of using plants for medicinal purposes. And some countries have developed protocols for engaging with communities to be able to get this information. I know, for example, in South Africa, the Indigenous Knowledge Bill, Dr. Matutu can comment on this. The Indigenous Knowledge Systems Bill was approved, if I recall correctly, but there is a program that funds IKS within the Department of Science and Innovation. So there is recognition of this kind of knowledge within our own system. And I think this is an opportune time for our scientists, our communities, our political superiors to develop this area further.
Thank you for that. Dr. Glover, would you like to come in on the issue of ethical review boards and the ethical process?
Yes. So what I was saying was that ethical review should not be applied wholesale. It should be applied based on the issue it's supposed to address. Because at the end of the day, if you keep to very stringent measures, and then what is to be done cannot be done, then it has not served any purpose. We have had situations, for instance, where we say that there are regulatory processes for carrying animal and plant products across borders. And some countries are very stringent on those. South Africa is one. We ever went to a meeting and somebody who is not educated, I should say unlettered, asked the question, if bees from Mozambique decide to fly into South Africa, how would they be regulated? But yet, if I'm traveling and I come to OR Tambo and there is a bee found in my baggage, which I've not declared, then I have a problem. So for those who are not lettered, sometimes they don't believe as scientists because we keep to those things so seriously, and then the practical issues that are to be solved are left there because we say that we must maintain the status quo. And it's high time that we relax a bit of those things so that we can achieve what we want to achieve. I'll link it to my issue about the peer review and then the preprint manuscript that I was talking about. I got some questions about that. The issue is not about peer reviewing being scrapped, but the process that it goes through, because we know that you can ask for peer review to be done and it can take ages. And you can also ask it to be done and it will be done and it will put your data that you have developed into a worse shape, because the person who is doing it sees you as coming up with something which is a challenge to him or her. So if we keep to those things, then we are stifling initiative, we are stifling interest, and we are keeping information back which is needed urgently to be used to achieve results and achieved very fast. That is what I've been trying to say. Thank you.
Thank you for that. Dr. Matutu, there is a question that has come through from my side asking about there's an announcement of a 20% cut of the NRF budget and the implication that it will have, particularly on prioritized areas of development, but also we're going to witness other sectors which were marginalized. For instance, according to this question, the social sciences suffering even more ahead of what this person calls the natural sciences. What can be done to assist with this new reality of budget cuts, but also trying to have research that is impactful on a wider spectrum of disciplines?
I think, as I said, we will just have to do more with less. And doing more with less becomes possible when we collaborate, when we work together, when we focus on transdisciplinary research, when we use the available infrastructure and we share the available infrastructure to do more. So let's take an example of what has happened through this COVID rapid response call that we have. What has happened is that South Africa has said we're funding South African universities. And the other partners have said we are funding the Arua universities, and we are funding the Science Granting Council's initiative from the 15 countries that we have been funding. And we've come together, we've put together this call, and we've insisted on collaborations that would occur across the continent and across institutions, which is saying that using the amount of money that we have, we've been able to leverage a whole lot more, both in terms of brains from scientists from other countries, their experiences, and at the same time, we have used the same amount of money that we would have used for our own researchers in the process. So I think more of this will have to happen for us to advance. Otherwise, we'll forever be crying foul. We have to leverage resources. We have to work together to resolve the big problems that we have.
Thank you, thank you. We want to tie it all up, colleagues, and I want to give each and every one of you to just make a closing statement in view of this engagement that we've just had. What advice would you give to the body of young scientists who are here with us, not only from South Africa, from across the continent, and some tuning in from across the world? What advice would you give as a take home in view of this discussion that we've just had? Let's start with Prof. Morton to give your closing remarks and one point of advice.
Thank you, Willie. Yeah, I actually want to come back to the very first point that I made in my presentation, and that is that ultimately my view is that good science will prevail regardless of the conditions. People who fund science, whether we live in eras of crisis or pandemics, whether they are decisions that are made on the basis of politics and ideology rather than good scientific advice. For me, the thing that I think a young scientist, emerging scholar must always pursue is to do the best science that he or she can do. And that means under the guidance and mentorship of established scientists. But if you pursue good science, if you practice the right protocols in doing your science, and you publish it in the best possible journals, that will be noticed, and that will receive further funding. So I'm an optimist around this. I think that people's reputations as scientists are developed over time if they get a reputation for doing good research. And I think we shouldn't lose sight of that, despite the new challenges that COVID-19 has imposed on us. So I'll conclude with that statement.
Thank you, Prof, for that. Dr. Glover, what advice would you give and your closing remarks?
Well, I just want to say that this webinar has been another interesting one. I'm so happy with what we have been able to come up with. I just want to challenge our, I would not say young scientists, I would say early career scientists, because we agreed that somebody can be 50 years and he's only just got his PhD. So you may not necessarily call him a young scientist. He's an early career scientist. They should know that science is dynamic, and as early career scientists, they are supposed to be versatile. They should be amenable to any changes. They should be open to find themselves in any arena and do the science that they believe in. I just want to use this opportunity to tell them about what the International Science Council Regional Office for Africa has done with ASAP and the DSI. We have been able to come out with what we call an African Scientist Directory. Dr. Matutu, she made a presentation on that the other time. So we invite the early career scientists to register, even if you don't enlist, because we are saying that you must have a PhD as a minimum to be able to enlist. But at least you can register and visit the directory. Try and look for scientists who can likely mentor you and mentor you well in the very interesting area that you choose to lead your life moving on.
Thank you, Doc, for that. At the Nelson Mandela University, Dr. Mkhwebi, what advice would you give to early career scientists in view of the challenge we have, and as a take home from your presentation, the final point?
Okay, thank you, Willie. My final point is that the pandemic comes at a time when there has been a lot of interest and scholarship towards Africa. And I think this is the best opportunity for us in the continent to really take a hard look at the resources divide, the digital divide and otherwise, that constrain full participation in intercontinental and in science and science research. Some of these constraints were never a reality for some elite institutions where there has been funding because there was travel. And that has been only for a few that could travel. But now this has been amplified, and it's going to have an impact on global knowledge production. So what I'm trying to say is that the circumstances that we find ourselves in require us to pay attention for reasons of equity, and this must be taken seriously. And in terms of early career researchers, I think the opportunities that the pandemic will bring, I'm very optimistic that there will be ample opportunities for global connections. Scientists want to connect, and therefore students are the drivers of that connection. The impact on women and girls is going to become even more, and this will be seen way after the pandemic. And I think it's up to the leaders in science and education to look at these before it becomes another pandemic, where we have less women, less girls, and less participation in research and in scholarship.
Thank you for that point and closing remarks, Dr. Mbwebi. Can we then have, finally, but not the least, Dr. Matutu, to give us your final take-home point and also your closing remarks?
From my side, I think the issue of early career researchers is an area that is very close to my heart personally, and an area that we have addressed extensively in a number of areas where I have worked. In the DSI, we produced a booklet which was looking at what the issues were on the early career researchers. And based on that research, which was conducted by Johann, we were able then to highlight the interventions which were necessary for us as the NRF to advance early career researchers. And on the basis of the intentions which were to produce leading researchers in science, we then realized that we do need an intervention. So this is on the cards. And I can see also that USAF is also focusing on this area of emerging researchers or early career researchers. So this is an area that we have identified as crucial, particularly to advance transformation, to advance the networks that have been highlighted, to advance the mentorship that is highlighted, and more importantly, to accelerate the development of the early career researchers to being leading researchers. So I do think that post-COVID, that is not going to change. All that is going to happen is that COVID would enhance and would further illuminate the need for research and for science in order to support decision making. So I do think that the times ahead are exciting times than where we are now.
Thank you, Dr. Matutu. Colleagues, thank you very much for availing your time from the busy schedules that you have and the important work that you are doing. I want to close off by a comment we've just received from Madlenkosi Sibanda, and this is directed to all of you. Thanks to the presenters. Very well contextualized and informative session, and we are appreciative of the wonderful work that you do in your various constituencies, and we notice this work. It's sometimes easy for us to just pinpoint what is wrong, but I think what we can get from this session is some energy to move forward in locating where our contribution is and how we can all work together for the betterment of livelihoods and communities out there. On behalf of the SAYAS EXCO, the SAYAS members, we thank you for all your contributions. And unfortunately, we could have had a nice cup of coffee, tea, and eats, but unfortunately, I just give you, there we go, I just give you electronic eats right now. Enjoy yourselves. Thank you for the wonderful work you do and the contributions that you make into the betterment of science and knowledge production in our country and on the continent. Thank you very much, colleagues. Over to you, Edith. Any announcements?
Thank you again. Just to reiterate what Willie has indicated, our gratitude to our panelists, our esteemed panelists, and also to our participants for raising important concerns and issues as well. We'll have a recording of the webinar and place it on our website and social media platforms, that at least then others who are not able to join can also feed into the insight shared. We'll continue having a series of discussions on webinar later on, different topics as indicated, and we'll share those to those who've joined and to others. But thank you once again. And if there are any other queries, questions that participants have, you can always email me have my contact details, and we'll try and get in touch and deal with those. But thank you once again, and to have a good day further.
Thank you. Thank you, colleagues.
Thank you. Bye. Bye.
Thanks a lot. Bye.